Hi guys, this is Kate at the AAFE. Today I'm doing some cheek filler. As you can see, I'm going down to bone, aspirating thoroughly, and pushing product. The patient has some numbing cream on her lips because she's also getting her lips done today, and we are using one syringe in cheeks and jaw just to kind of snatch her up a little bit. I mark up the patient just because that helps me visualize where I want to go. At this angle, I'm just going a little bit more at an angle just to lift the cheek and contour it more. Again, aspirating well, pushing product, and holding that cheek into place as I'm pushing the filler. I'm kind of just looking at the cheek now to see where else I would like to go. I decided that I'd like to hit my third spot that I drew up. So again, I'm going in at that same angle for lift. Trying to find bone, found bone. Aspirating thoroughly. And then once again, pushing the product once I see that there is no positive aspiration. If I come off bone even the slightest bit, I refine bone, re-aspirate, and then push the product. Again, holding the cheek into place, making sure I like where the filler is going. Here we're doing the jawline. We are doing the same technique that we did in cheeks. We are going down to bone, aspirating and pushing product. As you can see, I have a finger right there along her jawline, kind of just to define the jaw from the neck so you know where you're pushing product and it's easier to find the bone. So we're going down to bone, getting a good aspiration and pushing product. Here we just really wanted to maintain the jawline that we previously gave her. We also did her lips in this appointment, so we previously numbed her and cleaned her off, but now we are doing a 90-degree angle back-filled syringe lip technique. She just wanted to kind of have more symmetry in her top lip. We noticed over time her left side of her lip had more volume than the right side. So we just did the 90-degree angle technique, went in, and then slowly retrograded product as we came out. As you can see, I'm using a Q-tip just for added support, and the patient also has a little vibe to distract her from any pain. As we're going through the lips, we are massaging and looking for capillary refill to make sure there's no chance of her having a vascular occlusion. Again, we're going in at a 90-degree angle, pushing product slowly and retrograding throughout her top lip. As you can see, the patient has a beautiful lip shape already, so we're truly just using the filler to balance her and enhance what she already has. She has had her lips done previously, so we are kind of just evening her out. Again, going in at a 90-degree angle, retrograding product, kind of cleaning up the lips as we go and making sure that color and pigment looks good and that there is no vascular occlusion here. As you can see, we're really focusing on this one side of the lip. When the patient came into this appointment, she noticed that one side had more volume than the other. So when we assessed her, we decided that it was a great idea to target the side that needed more volume first and then go out through the rest of her lips. So now we're moving to the bottom of the lips. Again, 90-degree angle, checking depth, pushing product, and retrograding slowly. The patient expressed that she wanted a pouty bottom lip, so we're focusing in the middle pillows of her lips, pushing the most product there to kind of give her more of a pout. Here we're just doing the same thing on the other side. We're just replicating the same technique that we did on the other side to give her that pouty appearance. So we're going in 90-degree angle, checking depth, pushing product more towards the center of the lip to really focus on giving her a pouty bottom lip because that's what she desired. Like I said before, if you focus your product towards the center of that bottom lip and really just focus on outturning that, it will give you more of a pout in these patients who have larger lips and can handle more product and pout. As I go, there's really no technique of where I'm putting product and why. I'm kind of just looking at the patient's lips and assessing where needs more. It's truly an art to figure out what side of the lip needs more definition or more product. And that's kind of what I do throughout the lips. I kind of just look overall, assess, and then go in and lay more product. So once I'm done laying product and retrograding, I massage throughout the lips just to make sure I'm smoothing all of the bumps of the filler and I'm looking for good capillary refill or any signs of a vascular occlusion. Sometimes when I'm doing lips, I stop throughout just to massage, reassess, and then go in with more product. I massaged there, determined that more product was needed in a couple specific areas, went in 90-degree angle once again, pushing product, and then retrograding out. So now that we did the bottom lip, we're going to move to the area that really didn't need a lot of filler. It was the top lip that had more volume than the other side. So this is the area that needed the least amount of touch-up, so then we're just finishing up there. Once we're done, we're cleaning up the patient, putting a nice lip care on them just to kind of gloss them over. It makes them look beautiful, and it also allows the patient to see the true outcome of the lip filler that you did on them in this appointment. As you can see, we maintain the shape that we started with. We just kind of gave her a little more product here and there just to kind of balance her out and give her a fresh new lip. But overall, the base work was already there. Here she is loving the lips. She actually loves the swelling, so chances are in the future she's going to want her lips bigger.